because of the small sample size. Thank you, sir.
Thank you.
Next speaker is Dr. Safna Hamsa, free paper 80.
Good afternoon to all. I'm here to present the study on choroidal thickness changes after vitrectomy and silicone oil tamponade for egmatogenous retinal detachment. So the primary aim of the study was to assess the potential effect of silicone oil tamponade on the choroidal thickness after retinal detachment surgery, and the secondary aim was to evaluate the outer retina for any microstructural changes. So, silicone oil was first introduced by Paul Anton Sibitz as an intravitreal implant in the treatment of retinal detachment. Silicone oil are synthetic polymers of polydimethylsiloxanes with a viscosity ranging from 1000 to 10,000 centistokes. But in clinical practice, we use 1000 to 5000 centistokes. So, silicone oil is chemically inert, it has a high surface tension and a high viscosity. It provides an excellent tamponade, but prolonged duration of the tamponade may lead to anterior segment complications like oil emulsification, cataract, secondary glaucoma, and so on. So, the optimal timing for silicone oil removal is unknown, but many surgeons agree that silicone oil should be removed within 3 to 6 months of its injection to minimize these complications. So, we conducted a retrospective study in 20 eyes with acute egmatogenous retinal detachment who were treated with pars plana vitrectomy and 1500 centistokes of silicone oil tamponade. We had excluded patients with glaucoma, diabetic retinopathy, retinal vascular disorders, uveitis, and patients who had undergone any surgery, ocular surgery other than an uncomplicated cataract surgery. So, we measured and compared the choroidal thickness at the first, second and third postoperative month using an OCT line scan through the fovea. A manual caliper tool was used for this purpose to measure the choroidal thickness at the subfovea and at points 1500 microns nasal and temporal to the subfovea. An average of these 3 points were taken. We also evaluated the outer retina for any microstructural changes. The ellipsoid zone was defined as the second hyperreflective band above the retinal pigment epithelium. So, on comparing the choroidal thickness, we noted that by the third post-op month, it had reduced by 37.95 microns. Also, the outer retina showed microstructure changes in the form of ellipsoid zone disruption in 6 of the study population by the first postoperative month, that increased in number to 9 by the third postoperative month. In the patients with the ellipsoid zone disruption, choroidal thickness, more than 3/4 of them showed a reduction in the choroidal thickness by the third post-op month. The pinhole visual acuity had improved in 14 of the study population, that is 70% by the third post-op month when compared to the first post-op month. This pie diagram shows that in among 9 patients with ellipsoid zone disruption, more than half of them, around 67% of them, had a worsening of the pinhole visual acuity by the third post-op month. Here, I would also like to point out that all the patients with an intact ellipsoid zone had an improvement in their pinhole visual acuity. So, we observed that the choroidal thickness had reduced by the third post-op month, which was statistically significant, and our finding was consistent with the 2 similar studies that used 1000 centistokes of silicone oil tamponade. First one by Dominic Odrobina et al. In 18 patients with PVR retinal detachment, and the other study was by Al-Shehri et al. In 26 eyes with acute egmatogenous retinal detachment. In our study, we also noted an increase in the number of cases with ellipsoid zone disruption by the third post-op month, a finding that was consistent with a similar study by Duiguer et al. In patients with acute egmatogenous retinal detachment treated with 1300 centistokes of silicone oil tamponade. So, choroidal thickness showed a reduction by the third post-op month compared to the first month in eyes treated with silicone oil tamponade. A slight increase in the number of cases with ellipsoid zone disruption was also noted by the third post-op month. Most patients, however, showed an improvement in their pinhole visual acuity by this time, particularly patients with an intact ellipsoid zone. So, our study shows that silicone oil removal by around the third post-op month, once the retina is stable, will minimize the structural changes to the retina and choroid and maximize the visual outcome. These are my references. Thank you.
So these are almost in line with the other studies, no? Majority of the
Yes,
studies.
You have shown one case of inverse hypopyon. You have seen, no?
Sir?
Inverse hypopyon.
Yes,
You have
sir.
shown hypervolia.
Yes, sir.
It doesn't have inferior iridectomy. Why it was not done? Is it your photo or some other photo?
No, sir. It wasn't our photo. It wasn't our photo.
It's not yours.
No, sir. No, sir.
Not the study photo.
That was not our study photo, sir. That
In
was
these
just to
kind
show
of
the-
presentations,
yes, sir.
you should have only your original photos.
Okay, sir.
Supposing you are giving a description of the disease, it will be expert. But in your study, mostly you shouldn't. Thank you.
Thank you, sir. Thank you, sir.
Next speaker is Dr. Aparna S. Free paper 99.